Most of us have experienced a bruise or two, perhaps from bumping into furniture or after a particularly energetic workout. They are usually just a temporary, minor inconvenience that fades away on its own. But what if a bruise appears without a clear reason or seems to get worse instead of better? How do you know when it is more than just a typical bump or scrape? When bruising on your skin needs urgent care, it is typically characterized by bruises that appear without a known injury, spread rapidly, are accompanied by other symptoms like fever or severe pain, or occur after a significant trauma. These signs can indicate an underlying issue that requires immediate medical attention, distinguishing them from everyday bumps. The urgent need for care often stems from the bruise's origin or its presentation. A bruise forms when small blood vessels under the skin, called capillaries, break and leak blood into the surrounding tissues. While this is normal after an impact, unexplained or widespread bruising could signal problems with your blood clotting, a deficiency in platelets, or a more serious vascular condition. Rapidly expanding bruises, particularly after a head injury, may indicate internal bleeding that needs to be addressed quickly. Furthermore, bruises accompanied by swelling, severe pain, or an inability to move a limb might suggest a fracture or deeper tissue damage. If you notice a bruise that seems out of the ordinary, start by carefully observing its characteristics. Check if the bruise developed without any known trauma, if it is growing significantly in size, or if new bruises are appearing frequently without explanation. Pay attention to any other symptoms, such as persistent fever, fatigue, unusual bleeding from other areas like your gums or nose, or sudden, severe pain that does not improve. If any of these red flags are present, it is crucial to contact a healthcare provider or seek urgent care promptly for a proper evaluation. An important distinction to consider is the difference between simple bruising and purpura. Simple bruising usually results from trauma, often resolves through a predictable color change cycle, and does not cause severe widespread discomfort. Purpura, on the other hand, refers to purple or red spots on the skin that do not blanch or turn white when pressed. These can range from small pinpoint spots, called petechiae, to larger patches, and they indicate bleeding under the skin that may be linked to systemic issues, such as blood disorders or severe infections, warranting urgent medical assessment. Understanding these key indicators and acting quickly can make a significant difference in managing your health. By recognizing when a bruise signals something more serious than a simple knock, you are taking proactive steps to protect your well-being. It is always better to have unusual or concerning skin changes evaluated by a medical professional to ensure peace of mind and appropriate care.